anonymously? Is there any way to kind of,
Yes.
okay, tell us a little bit about that.
Yeah, so I definitely have patients who are worried, and legally things are starting to kind of shift in this direction where they're starting to talk about not being able to discriminate based on genetic predisposition, et cetera. But there's plenty of people who are worried about what that means. 23andMe is an online test. You sign up online, you order the test kit, they mail it to you, you spit in the vial, you mail it back, they give you the results online. You can give them whatever name you want, you can pay in whatever form, it's usually a credit card. I mean, you could do it via a different way. Genetic Genie, where you're uploading, and a lot of the other sites where you're uploading, you're just uploading the raw data. They never ask for a name. I mean, the Genetic Genie, it literally takes a minute. I mean, you upload the data, and then it produces this spreadsheet on the computer in front of you. There's no place to enter a name or any other kind of identifying information. So, I think, and I definitely have had people do this anonymously plenty because they're worried about things.
So, I mean, who interprets for them, though?
Well, and that's the thing. Some of the online sites will do some interpretation, and that's the other thing about this is that it's an ever-changing field, right? Like we think we understand something and then we learn something more. We think this is the only pathway for this certain toxin to go through, and then we realize there's two other pathways as well. So I think this is going to continue to be an evolving field. We're going to see that some of these are actually more important and some of these are less important. Like we don't need to worry about that one. Who cares if it's a mutation? Hardly anything goes through there. But I think for right now, it really is an amazing tool because it's starting to individualize the process. Why is it that all the firefighters who are on the same scene, only some of them get sick, only some of them get cancer? How do we figure out what's happening in my body and what are my individual risks? And it starts, I think, in this way by being able to start looking at the genes. Functionally, like I said, the next part to that is actually looking at the functional outcome. If your vitamin D is totally normal, then we don't need to worry about the fact that you have a VDR mutation in your receptor. For whatever reason, your body is making vitamin D just totally fine and it's responding totally fine. So there's a little bit of that, like back and forth, where you're looking at the gene, then you're looking at the function. And again, like I said, with the 2 copies, I liken it to this idea of a cookbook. All of these genes are just recipes in a cookbook. If you never make pot roast in your life, you will never know that the recipe is rotten, or that there's mistakes in it. So the only way you know it is if your body needs that enzyme and makes that enzyme, and then the enzyme doesn't work very well.
Yeah. Well, I guess we're looking at the whole picture, so this is certainly part of it.
This is part of the whole picture, yeah.
Okay.
So then moving on to your ability to detoxify, this is going to help us in terms of what's happening specifically. So when you get a complete blood count, which is a CBC, which is pretty routine, looking at the size of the red blood cells helps us to say, oh, you might be folic acid or B12 deficient. Looking at your homocysteine level helps us to say whether or not you have a methylation problem. Is it too high? Is it not too high? And CMP, looking at liver function, looking at kidney function, trying to see how is your ability to detoxify. So, and then understanding the terrain. So this is the big picture. What's happening in the rest of your system? Are you inflamed? Do you have blood sugar issues? Are your hormones out of balance? Are your stress hormones out of balance? Are your liver enzymes, your lipids, your liver ALT, AST out of whack? Are other endocrine organs impacted? And so here we go with the specifics. Basic terrain testing, I think everybody should be having a CBC and a CMP. A CMP stands for Complete Metabolic Panel. Both of those are just kind of routine, basic, gives you a sense of red blood cells, white blood cells, and all your kind of electrolytes and your liver enzymes and basic kidney functions. Then I think it's important to get a CRP-HS, which is a high-sensitivity C-reactive protein. And that is just looking at inflammation in your body. Are you really inflamed or are you not inflamed? That impacts your risk for cardiovascular disease, but it also impacts your risk for cancer. It impacts, inflammation in your body. Looking at blood sugar, so not just the fasting glucose that you'll get in the CMP, but also running a hemoglobin A1C. So that's a 3-month picture of what your blood sugar has been like. A glucose is just the fasting morning. How well do you do fasting overnight? The hemoglobin A1C really gets us an image of what has the last 3 months been like in your body. Maybe you do great fasting, but actually after you eat food, you don't react well and your blood sugar stays high for too long. That'll show up in the hemoglobin A1C. Doing thyroid testing, running a full thyroid panel, making sure you don't have antibodies against your thyroid. And homocysteine, which I talked about a little bit before, but that is a really good marker for methylation. Vitamin D levels, running both a 25-hydroxy and a 125-hydroxy. 125 is the active form of vitamin D, and you want to make sure that you're converting them. Sometimes when people check their 25 and it's way too low, and then they start supplementing with 25 and they continue to check the 25, but they don't realize that there's actually a problem in the conversion, and their 125 is actually really high. And so then we need to kind of talk about, okay, wait a minute, you need vitamin K, you need some other nutrients, because you need to bring the 25 up, but you need the 125 to not be at toxic levels too. And then digestively, finding out if you've got healthy gut flora, checking for parasites, checking for inflammation. Again, when I'm doing lab testing with people, I'm thinking about what people are coming in with. So when people come in and have exposures to parasites or have a bunch of digestive complaints, I'm much more apt to run a full digestive panel than if someone's coming in saying, no, they don't have any digestive complaints, everything kind of running smoothly. So, that's one of those things that's pretty individual depending on what's going on. But like I talked about before, inflammation in your gut is going to mean the toxins can just float right on in. Having bad flora in your gut, not having good bacteria, means they change the chemicals. It methylates the mercury coming into your gut. It makes it much more absorbable and much more toxic. So, checking for current toxins. So heavy metals are the ones that are stored forever. They get stuck in your bones. They get stuck in different places, and they impact the ability to kind of get other things out. PCBs are more fat-soluble. Solvents, like we talked about before, are really transient. They're not really well tested. Heavy metals, in spite of the fact that they actually get stored for many years, they move around sometimes. And the times that they move around are during pregnancy, breastfeeding, and hormone changes. So in women during menopause, but also in hormone change time for men. And what that means is the bones are remodeling, and so they just move back into circulation. So all that lead that kind of got tucked away during pregnancy comes right back out in circulation and is there kind of exposing not just the mom, but also the baby, which brings us to a bigger thing, which is that all of us have inherited the toxic loads that our mothers had in utero and with breastfeeding. So all of those toxins were mobilized during pregnancy, and all of us got that load. So part of what we're seeing is this accumulation of what's happening over time as the load is getting higher in all of us, and we're dumping that into the next generation. The Environmental Working Group, which we talked about earlier with the Dirty Dozen, has an amazing video on there about cord blood in babies, where they basically tested cord blood in babies for all of these toxins and just found high levels of all these different pollutants in babies who had never even taken a breath yet. So it's clear, and we know that it's happening now. So heavy metal testing. In order to do heavy metal testing, you have to have normal kidney function because you need to be able to take a chelator. So those are the two tests, usually serum creatinine and a urine beta-2 microglobulin. The testing is actually a urine test, and there's actually two tests. You want to run a pre and a post, because remember, those heavy metals are not actually floating around in your bloodstream anymore. Unless you're currently being exposed, they all have a half-life. I think lead is around 55 days. After 55 days, half of the lead that you've been exposed to is gone. It's been tucked away, and we're not going to see it. So the way for us to see it is to use some sort of chelator that's going to bind that and pull it out into circulation. So the way that we run the testing is you take home 2 urine kits. First thing in the morning, you urinate, you get what basically in current circulation. You take a chelator, and then for this next 6 hours, you basically collect your urine and see what's coming out with the chelator. It's not 100%. You're never going to be able to actually see what is all in your body. What you are going to see is what is the DMSA binding to and pulling out. Sometimes what we see is one metal is coming out a lot, like, a ton of lead is coming out at the beginning. And as the lead starts to drop, the next thing that starts to come up is arsenic. Part of it is the binding ability. So DMSA really likes lead and mercury. It binds less to arsenic, although it does bind to arsenic. So it's selectively sucking up all the lead and mercury. And once there's no more lead and mercury, it's around to then be able to suck up other things. So there's no actual way to see what is the total dose in the body, but you get a pretty good sense. And then, if you have heavy metals, you want to get them out of your body. And so depending on which ones, you're going to be doing different kinds of chelators. There's EDTA, DMSA, and DMPS, which I didn't mention on here, but and there's various other ones, and it kind of depends on what's the toxin that's showing up. Is it cadmium? Is it mercury? Is it lead? Is it all three? What are we going to kind of do? And then there's all sorts of different regimes for chelation, which is basically you're taking some sort of chelator for some period of time, and then you're going off that chelator and replacing your nutrients and your minerals for some period of time. And ideally, during that time, you're doing saunas and you're doing some other things, which we're going to talk about more, to help move stuff out of your body. But it is totally possible, and many, many, many people have done it and gotten metals out of their system, so stop them from being tucked away and stored away.
So if you did heavy metal testing and you found that you had increased levels of, some of the ones you listed there,
Yep.
and we can actually do something about it, to help pull some of these these past exposures that we've had, maybe at fires and stuff like that. It's not just though I've got this nothing I can do about it. There's some things that you can actually, as an individual, go through this process of detoxification. That's kind of under like the doctor's care, like you.
Yeah.
Okay.
Yeah, and I think it's really important. And my ideal wish or dream is to be able to do something like this, do some sort of trial, in the fire department, and come in and basically get baseline blood work, do a baseline questionnaire, get metal testing, and then, have people do a series of chelation and get the metals down, and then check blood work again and check questionnaire again and see how people are feeling, because it's not just, this imaginary risk of cancer. I mean, it's also very specific, high blood pressure being linked to lead and blood sugar problems and how you feel, foggy-headed and not being able to think clearly and not having energy. And so all these things that we kind of write off sometimes by thinking it's just aging, this is just what happens. And it's actually that we're just getting more and more toxic, and we've accumulated more and more stuff, and we need to get it out.
Yeah, I know we talked about that once at a previous meeting, but I guess we'll have to explore a little, how we would do that later. I don't know. I mean.
Right. It's okay. It's still my fantasies.
Yeah.
So fat-soluble toxins come out a little bit differently. Remember, they're stuck in the fat, and this isn't just the fat of your fat cells, but also fatty parts of the rest of your body, so the fatty parts of your brain, etc. PCBs, flame retardants, all of those dioxins and chlorines that are coming out with the plastics. We get those out in breastfeeding. So remember I talked about all of them moving around the body when you're pregnant and breastfeeding. They're moving around in breastfeeding. They're moving around. They move around with sauna and exercise and fiber and Olestra. And I'm going to really go into detail with Olestra. So I know you're all excited to go eat fat-free Pringles right now for lunch, but hold off. So toxins are released through the sweat, the breath, the urine, the feces, and the breast milk. And there's actually a study going on right now at the University of Arizona. They were talking about having results at the end of 2013, but As of May 2014, we don't see those yet, but they're actually analyzing breast milk in firefighters immediately post-fire, 8 to 10 hours post-fire, 24 hours post-fire, and 72 hours post-fire. And part of what they're hoping to do with this is be able to assess how quickly are the toxins that women are being exposed to who are breastfeeding, how quickly is that translating into the breast milk? Because that's really going to be able to help identify where you need to pump and dump as opposed to kind of breastfeed. So all of these women have been collecting breast milk and sending it in frozen, labeled with all of these hours, and they're going to start analyzing it, and they're basically matching non-breastfeeding, or they're matching it with breastfeeding non-firefighters in the city.
So quite a few studies on this stuff. Starting to feel like a lab rat. The World Trade Center people and the San Francisco firefighters attaching stuff to their, seeing what they, accumulate inside fires, so.
Yeah. Well, and it's high time. I think that the more that this gets studied and the more that changes are going to happen, where you're going to have access to more things, all the stuff that we're talking about, having 2 sets of turnouts or even 3 sets of turnouts, having better access to things, having more personnel so that you can actually go and detox and decon and clean up before you get to a medical call or before you go on to another thing. So I think that that's important.
Okay.
Sorry, you feel like a lab rat.
I'm just, there's all these studies,
I know.
Yeah.
Well, but you're not nursing, right? You're not a
Correct. Yeah.
breastfeeding fire, yeah. So sauna. There's basically radiant heat saunas and infrared saunas. And the radiant heat saunas are kind of the more traditional ones that you see. That either they're dry or they're steam, but they're kind of heating you up. You walk in, it feels hot. The infrared ones are actually using wavelengths of light. Some of those are visible, some of them are invisible, but they're not heating the air around you, they're just heating your body. There is a lot of debate about this, and there's a lot of controversy, and some people are really attached to one over the other. Some people feel like infrared is better because it's going deeper in the body. Some people feel like infrared actually doesn't go that deeply in the body. The truth is that both are heating the body, and both are causing sweating. The majority of the studies have really been done on radiant heat saunas. So we have less data on the infrared saunas. But I think both are heating the body and both are causing sweating. And what we know is that toxins are released in the sweat and they're moved into circulation when you're heated. So both of them, I believe, are going to be beneficial. They feel different. Some people like the feel of being able to walk into a hot sauna and being able to feel the temperature be warm and sweat in there, as opposed to sitting in something that doesn't necessarily feel warm, but slowly getting warm. Infrared saunas are smaller. They're usually 1 or 2 person, so they're less expensive to heat up and use, but they're also not necessarily a social thing or not necessarily like radiant heat saunas. Sometimes people have in family homes and multiple people are sauning at once, and that's, more of an experience that they want to have. So I think that there's some individualness. I don't think that one is better than the other. So I'm here to say they're both good. What we know is that there's a lot of data on hypertension, on heart attacks, on all this kind of cardiovascular systems being helped by doing saunas. Again, they're using different temperatures of saunas and different types of saunas and different lengths of times of sauna. So we start getting into like, well, how long should I do it and what should I do? One of the blood pressure ones, they had people sauna every day for just 15 minutes. And it was enough to have them drop their blood pressure almost by 10 points, systolic and diastolic. Some of the heart attack studies, they were only saunaing every 2 weeks. So there's a huge variation in kind of how people sauna and how they use sauna. The clinics where people are doing intensive detoxification because they're really, really sick, they are often saunaing anywhere from 3 to 5 hours. They're in there for a long period of time. They're trying to move stuff out of storage and out into circulation. So, it's a huge time commitment. The people who are doing that huge time commitment are pretty sick. They're motivated to take a month off of work and every single day sit in the sauna for 3 to 5 hours. So, I don't want people to think that that's the only way of doing it and then not sauna at all, because we can show that 15 minutes of sauna a day is enough to bring your blood pressure down after a couple of months. So you will get toxins out no matter how long you're in there. Part of what it does is it's mobilizing the toxins that are stored in the fat, and that is then moving around in circulation. So that is then moving into the sweat, it's moving into your urine, it's moving into your stool. In the fat that is right underneath the skin, it's just coming straight out. So it doesn't even need to go into the bloodstream. It just comes straight out of your skin. The rest of your fat cells are usually dumping into circulation and then, based on that circulation, coming out through some other exit route. Which brings us to you have to have all the exit routes working well. If your other exit routes aren't working well, if you're constipated and you get in the sauna and you move all that stored PCBs and toxins around, it's not coming out. It's going to go right back in, and probably it's going to get redistributed, and probably you're going to feel sick as it moves around your body. When it's tucked away in storage, it's not harming you. When it starts moving around again, that's when we're starting to have a problem with it. So we have to make sure all the other exit routes are working well before you kind of embark on this. A lot of things are released in the sweat, minerals, all these different kind of minerals and elements, antimony, cadmium, lead, mercury, nickel, drugs, various metabolites of drugs, PCBs, like I talked about. They did a review study in 2012 where they looked at 22 different studies that were looking at metals, heavy metals in sweat, and basically they found that they were almost always higher in sweat than they were in blood levels, and that you could bring mercury down to a normal level after you've had multiple saunas, and that more lead came out with endurance exercise than intensive exercise. So again, part of it is like, where is it, how is it coming out, how's it moving out, and what's happening with it. They did this study on electrical workers who were exposed to a lot of PCBs. And they did 3 weeks of high temperature saunas, plus niacin, plus a bunch of oils, plus a bunch of nutrients. And they did fat biopsies. So this is fascinating because rather than just looking at blood, they were looking at where it's actually deposited. And there's problems with fat biopsies because you're only getting that certain cell. And what if a different cell has a different amount? But still, it's a better picture. And what we saw was that PCBs decreased by 16%, and hexachlorobenzene, which is another fat-soluble toxin, decreased by almost 30%. This was after 3 weeks of doing this kind of protocol. Part of the protocol, there was a lot of nutrients, there were a lot of electrolytes, there was a lot of different things in there. I don't know why it did that, but I didn't do that. Oil is another component here that I hinted at the fact of wanting to add fish oil, and I didn't add fish oil. There's a lot of conversation about if you're ingesting a whole bunch of really good oils, that you're helping to kind of push out the bad oils. And with the bad oils, you're possibly helping to push out a lot of the fat-soluble toxins. So it makes sense to think about what oils you're eating and what you're doing. So with sauna, start slow. Make sure you're sweating, stay hydrated, and take electrolytes. They sell electrolyte tablets. It's basically potassium, and a little bit of salt, some magnesium, calcium. You want to keep your electrolytes good. You want to make sure that you're staying hydrated. Cold showers during and at the end, and then slowly increasing the length of time in the sauna. So, if you're in there, some people get sick and cannot do it very much at the beginning. They need to do 10 minutes or 15 minutes. Otherwise, they feel terrible. And that's one of the ways that you can kind of assess what's happening. Do you feel terrible? Did you take one? Do you have a headache? Do you feel like you've been run over by a truck? If that's the case, you've been in there too long. You've moved too much stuff, and it's not actually getting out. So you need to back up and do a little bit less time. Do it to the point where you're still feeling good. And over time, what you will find is you will sweat sooner, and you'll be able to tolerate longer sessions. So I've had people who can't tolerate more than 10 minutes, and suddenly, they can tolerate up to 45 minutes. And it's been this gradual increase that's happened over time, where they've been able to tolerate more and more, and they've been sweating sooner. Take a cold shower. When you start to feel really hot, you're sweating, you're covered in sweat, take a cold shower, rinse it all off, and cool down a little bit, go back in and do it again. You know, in those long hydration ones where people are doing it for 3 to 5 hours, you know, they're taking cold showers every 30 to 45 minutes. They're cooling down, they're going back in again, they're doing it again, because you're mobilizing deeper levels of things from your fat cells. Ideally, you do a little bit of exercise first. Actually, 15 to 25 minutes, 20 minutes of exercise, cardiovascular exercise. You're going to increase the blood flow to the rest of your body. You're going to start moving the toxins around and be able to help get them out of fat when you start sweating. For the far infrared sauna, it's a lower temperature, 125 to 135. For the radiant, 140 to 180. There's a lot of variability here. You know, Dr. Walter Crinion, who did this for almost 30 years up in Seattle and had a really intensive clinic, he did radiant heat much lower, 125 to 135. You know, there's been other protocols where people are doing it much higher, 160 to 180. I don't think that there's a wrong answer. I don't think we know enough. I mean, I think if you can tolerate it, if you can be in there, I think the hotter it is, the shorter the time you're in there, and that means that you're going to mobilize less fat. So I think it does make sense to try to be in there longer, and if that means cooling it down a little bit or cooling yourself down more frequently, I think that's worth it. But you're going to get stuff out if you sauna. And again, 30 minutes to 5 hours. I mean, you know, that one study was 15 minutes. Thinking about getting cold showers and maintaining your electrolytes. And now we get to talk about fat binders. So we've talked about fiber and how your digestive tract, really, you're recirculating your toxins, and you will reabsorb those toxins if you don't bind them and get them out. So one of the fabulous, amazing discoveries we've made is Olestra. It was actually discovered in 1968 by Procter & Gamble. They thought it could help lower cholesterol, but that didn't really pan out. It's this fat substitute, and it's a really big molecule, and it actually passes through the digestive tract. It doesn't get absorbed. It just goes through unchanged. So people got really excited about that and thought, you know, nobody wants fat anymore. Everyone wants to have fat-free. So we've got this amazing thing. It passes through. It doesn't, you know, it looks like a fat, but it passes through, doesn't really change anything. So let's add it to things. So starting in 1996, they started adding it to potato chips and a bunch of high-fat products. And one of the side effects, of course, was loose stools, abdominal cramping, and loss of fat-soluble vitamins. So what happens is it actually passes through unchanged, but in the digestive tract, if there's any other fat-soluble anything, any other fats, it binds those up and takes them out with it. If you eat a pretty fatty meal with it, you've got all this fat that's not going to get broken down or digested, and it's basically going to give you abdominal cramps and diarrhea. I mean, you're going to feel terrible if you have a lot of fat with this. So then what happened was they've started discovering that it actually helps to bind fat-soluble toxins. So here we have all these fat-soluble toxins. We don't know how to get them out of the body, and they discovered that we can use Olestra to actually help bind them up. The very first study was not actually this one. The very first study was with a man who had a really high level of PCBs, and he was so sick that he basically had chloracne. He had all of these kind of toxic symptoms. He couldn't do anything. He had high blood pressure, diabetes, etc. And they ended up just doing this, where they did 7 chips of Pringles with Olestra in them every day. And that was enough to bind up the toxins in his digestive tract and get them out of his body. And his levels just decreased and decreased and decreased. So now they're doing it more and more and more. And in Anniston, they just did this, they just published this April 2014. They were looking at PCBs and DDEs, which happened to be really high. And many of these people have diabetes and high blood pressure. And so they gave them either 15 grams of Olestra or vegetable oil. So they gave them potato chips, one either with vegetable oil or with Olestra, and basically showed that they can totally bring down their levels of PCBs. And part of what got really exciting and where they're going with this is they want to actually see, does that actually change their blood pressure, and does that change their blood sugar by bringing it down? So There's been many, many other studies now. You can go on PubMed and kind of search for Olestra. Basically, 7 chips of fat-free Pringles is the equivalent of 25 grams. And we know it brings down hexachlorobenzene, PCBs, PCDDs, and other persistent lipophilic contaminants. So remember when we talked about all these contaminants being in your body forever, you can get them out. This was an article that came out in January 2012 by Dorothy Merritt, who's a physician in Texas. She does a lot of environmental medicine, and she basically wrote this article talking about the Olestra detox diet and how basically by taking this fat, fake fat, you can actually help to bind up toxins. So, you know, I don't necessarily think we should all be walking around eating Olestra every single day. But there is something to be said about binding those toxins when they're in your digestive tract and you're trying to get them out. So, you know, we've joked about having Pringles, you know, on the rehab truck. You know, while you're being exposed, you know, what about if we bind those things up and you don't actually absorb them in your digestive tract? You know, what about when you're saunaing? You know, having Pringles when you're saunaing and you know you're moving those toxins, and now you can actually bind them and get them out of your system rather than have them recirculate. It's not all the Pringles, and they are a little bit trickier to find these days. So it is the one you have to look for it. It has to say Olestra on it. It'll have this kind of caution on it that it can cause abdominal cramping and loose stools. I recently bought a case of them to have in my office for patients, and I got them on Amazon. So you can still find them at Walgreens and Fred Meyer and things like that, but sometimes they haven't been selling that well because of the bad rap they've gotten, and so some of the stores are now deciding not to carry them. So it's getting a little harder to find. If we lose this beautiful option of potato chips, there's actually Orlistat, which is a little bit different. It's a lipase inhibitor. So it's not this big molecule that looks like a fat. It inhibits lipase, which is an enzyme that breaks down fat. It's a drug for obesity. You can buy this over the counter, Ally. And, you know, it also has a caution that the side effect is loose stools. It's really interesting. They actually have this study showing that with diet changes and exercise, people who used Ally for a year lost an average of 4 to 6 pounds. I was like, wow, you made diet changes, you started exercising, and you lost an average of 4 to 6 pounds after a year of taking this drug. Like, not really sure the drug's doing that much. But what we do know is that it is a lipase inhibitor, so the same kind of thing. You eat a bunch of fat, it's not going to get broken down by the lipase and absorbed back into your system, but instead it's going to come out. And that's what we want. All right. Ready? We're going to put it all together. This is it. I mean, basically, we want to reduce your exposure at the scene. We want to reduce the re-exposure. This is from dirty gear, the dirty cab, the contaminated station. We want to strengthen your body through changing your diet, taking nutrients that you need, reducing your body burden, because that'll strengthen your body. You'll have a stronger body if you don't have as many toxins in it. And then you want to eliminate what did come in. So you want to do saunas or Olestra or colonics, water, nutrients. I didn't talk about colonics, but you can guess that it's along the same line as the Olestra. It's basically you need to get stuff out of the digestive tract and not have it just recirculate. And colonics is a great way of doing that. So this is basically what we've just talked about. That's it.
Wow. Well, that's certainly a comprehensive look at the entire topic of cancer in the fire service, and, you know, I guess our most to-date information about what we can do to help protect ourselves. So
Right.
I can't tell you how much, can't thank you enough, Dr. Tolzmann. You've put a tremendous amount of time and effort into this. Carl spoke highly of you, and I, you know, from all the firefighters, let me just say thank you. Thank you for your time and, you know, for, you know, caring about us. We really appreciate it.
Thank you.
Yes, thank you very much.
Thank you.
Yeah. Thank you.
Okay.